And there are no measles cases reported in the coastal bend, but how would our area react if there were one? Our Seth Kovar went looking for answers. He joins us now in the studio. And Seth, was Austin's handling of the measles case a good example to follow?
Well, Paulo, I was not able to talk to the health district today, but I did talk to a physician's assistant at a clinic. He says Austin is doing it right. They identified the measles patient, noted where he traveled while contagious, and alerted the public about it. It sounds like that's what would happen here if a case of the measles ever pops up.
It doesn't worry me. The only worry I think I have is that it is so preventable.
If you've had 2 shots of the measles vaccine, physician's assistant Mark Stearman says you have nothing to worry about. But for those of you who don't, there's a lot about the virus you need to know. For one, it's really bad for kids.
For adults, it can be not as serious as with the small children.
It can even be deadly for kids, especially if their symptoms, like a fever around 104, aren't treated. And those symptoms at first are confusing because they're just like the flu, a virus that Stearman says you should really watch out for.
Flu deaths in the United States are in the tens of thousands, and so I wouldn't necessarily be any more worried about an isolated measles case than I would be about a flu epidemic.
And if that isolated case does pop up here, Stearman is confident local health leaders can keep other people from getting sick.
Finding the source patient, if you will, it would be very important. And then, from the infectious disease, communicable disease, moving outward in that ring for all of those associated contacts.
That physician's assistant says the rash that we associate with the measles actually doesn't come until 3 or 5 days after you start experiencing those flu-like symptoms. He says it usually starts on your face and works its way down. Paula?
All right, Seth Kovar reporting in studio.